In a world of EMS podcasters, EMS Office Hours is the only live podcast bringing you the latest topics and opinions in EMS. Turn down your scanner and turn up your speakers as we join Jim Hoffman and Josh Knapp on their latest EMS podcasting journey.
Hey, Jim Hoffman here for EMS Office Hours. We are post July 4th. Oh my God. Halfway through the year, pretty much. Guys, listen, before I get started today, just if you like the show, you get any kind of value out of it, you want to leave me 1 star, 2 stars, 5 stars, please go to iTunes, go to EMS Office Hours, and like the show, give me a review, subscribe to the show there. It really helps the rankings. I mean, I've got about 9,000 downloads of this show a month. I'd love to get it above 10,000, but the amount of downloads doesn't really reflect anything in iTunes unless people are actually subscribing and reviewing it and stuff like that. That's what gets my rankings up there. So they could be a show with less downloads than me, but if they have more subscribers, they get a better ranking. So, not that I'm begging, but please go to iTunes, guys, and subscribe here on the show. There's a link on the page here to do it. Just hit that link, it'll take you to iTunes, and then just go ahead and subscribe and like it and review it and stuff like that. All right, I really appreciate it. Of course, follow us, guys, on Twitter and Instagram. It's EMS Safe on those venues. And be sure to leave a comment on the blog as well at emsofficehours.com. Okay, so today I'm just wondering if you ever thought about what your specialty is in EMS. You know, a lot of industries, doctors and nurses, let's just give that as an example, since that kind of relates to us a little bit, right? They have specialties. So someone goes to doctor school, and then they become an anesthesiologist, they become a gynecologist, they become an oncologist, whatever the case may be, right? And nurses, they specialize in their deal, right? You get emergency room nurses or critical care nurse or whatever that pediatric nurse, right? And of course, these specialties, you know, when these docs and nurses do this, they go to more schooling, right? And they kind of specialize in that area, and most of the time they'll get paid more money because they specialize in that specific area. But yet they are still familiar with everything else that it takes to be a doctor or to be a nurse, right? So my question to you is, what do you specialize in as a paramedic or as an EMT? You know, sure, we're not going to get more money out of it, right? Let's give up that dream, okay? But we can be better providers and professionals by sort of having a specialty. And if you look around, you'll see other providers, and I've noticed this over the years, right? You'll get a paramedic, and he's really into, let's say, EKGs, right? And there are a few paramedics out there that are like that, where they have their own actual website, all right, and or a blog or whatever, and it's based on that. Let's say 12 lead ECGs, right? Tom Boothway there, he is big into 12 leads, right? He's big into that. So he's got a blog. He's got a system, a career, or whatever, a recognizable aspect of himself that's attached to that. That's sort of his specialty. Not that he doesn't know anything else about being a paramedic, and outside of 12 leads he's lost, right? No, his specialty is 12 leads. So, and I've noticed over the years, personally, paramedics and EMTs who are really into specific areas of the job. Maybe it's CPR, ACLS, maybe it's, trauma, maybe it's pediatrics or geriatrics. I've noticed over the years that there are providers like that who sort of specialize in that. And as a provider, for yourself, what is it that drives you? What is it that interests you the most in EMS that you can specialize in, right? Something that maybe will make you more valuable to your agency, right? So if there's something going on with a specific call type or a call that might have happened that's being reviewed or whatever, you can, maybe get called in to consult on that particular call, right? Because you've got a little more knowledge and they realize that than everybody else. Not that you're a better paramedic or, you're somebody that is the I guess the end all authority on it, but you sort of specialize in that, right? For me, I've been big on the operational side. I've been big on things like giving call reports. I've been very big on geriatric. CHF actually is my biggest sort of specialty, right? Understanding congestive heart failure, treating it, the things that go on around it, right? I am very big on that aspect of EMS. Okay, and that was because early in my career I ended up having a lot of patients in the area that I worked in that were CHF patients, right? And so that sort of pushed me into that as being my specialty in this job early on, because I wanted to know what was going on with these patients. I had so many of them that I wanted to know. I wanted to identify it faster. I wanted to be able to treat it faster, okay? And it really drove me to kind of really know a lot about what goes on with CHF patients and telling the difference between, CHF and pneumonia and cardiac wheezing and all that type of stuff, right? So that was my deal. Now, while I'm still interested in that, I've been kind of delving into and looking into things like sepsis, right? Because I'm kind of recognizing the value that we can bring to medicine and the long-term care of the patient by being able to identify sepsis early on in the field, right? And I've been looking into that a lot too, okay? And while that kind of goes against some of my thought process of we can only do so much in that 30-40 minute window we have the patient, I think that is something that we can actually kind of lean towards that can make a difference in the patient, okay? And that's the type of stuff that I like to get into when it comes to changes in EMS and where we're going, not ultrasound and nonsense like that, but actually doing a clinical assessment of your patient and a good history and figuring out what might be going on with them. So that's sort of my way that I angle. And of course on the website side, a lot of you are familiar, my specialty is like podcasting, what I'm doing now, like making videos, like knowing all there is about exam taking and understanding that whole process, right? Not just sitting down taking the exam, but everything that goes on around it, the questions, the answers, how they're developed, how you look at them, right? So that is sort of my little niche of areas in EMS. And if you think about it, there are so many more of those niches that you can get, that I could get into, right? But I try to limit it because there's only so much you can get into and really be a specialty. A lot of us in EMS, what do? We know sort of a little bit about a lot of things, right? Which is great, and that's what makes us be able to identify things, on the spot, right? When we assess these patients. But again, having a little bit of a specialty can really bring value to your patients and your agency. And now, it also could bring value to yourself, knowing for yourself that, hey, I know a lot about this information. This is my little shtick here, right? This is my thing. Okay? So that's why when I ask you what your specialty is, I want to kind of drive you or motivate you to say, okay, maybe I don't really have a specialty. Maybe there's nothing out there that really I've been clinging to, right? Take a step back and start trying to think, what's out there within EMS that interests you? Something that really gets you going when you have a call, right? Maybe it's a respiratory call. Maybe it's pediatrics, right? Maybe it's EKGs for you. Maybe it's geriatrics for you, right? Maybe it's MIs and STEMIs, not necessarily the EKG end of it, but all the other parts of an MI and a STEMI, right? So if you don't have something that is sort of your specialty, try to think about what it is that you can maybe focus on, okay? And I think that if a lot of us did that, and within one agency, many of us could work in a place where each paramedic would have sort of their own little specialty in different areas of EMS. And again, bringing value to the patients that we're serving, to the agency we're working for, and again, to ourselves, by being able to build that knowledge base, be more valuable to ourselves, right? And really build the knowledge that we have that allows us to really take care of our patients to the best possibility that we can, right? So while you might hear me rant a lot on this show about some of the injustices of EMS, don't think that I am against being a professional care provider, right? But to me, I want us to be professional care providers for what matters, all right, for patients, where we can go with patients, what we can do for patients, okay? Not that new shiny object, okay? And that's what gets me going. But again, what's your specialty? And there's one side note before I end today, guys, all right? Talking about specialties, right? And we talk about nurses and doctors before and, you know, what they go into. You think about specialties in EMS also being things like being a flight paramedic, right? Being a community paramedic, that's the new thing going on, right? But what about the transport paramedics? I often used to say that why isn't transport paramedicine, not critical care, right? That's another specialty as well, but just your run-of-the-mill, everyday paramedic that works for a transport company, why isn't that a specialty? Why doesn't that command a little more money like a flight paramedic or like a community paramedic or a critical care paramedic? You know, too many times it gets looked down on as the Gomer bus, right? You're just taking them to the hospital, into facility transports, stuff like that. But the reality is that, you know, transport paramedics have to know a lot more than 911 paramedics sometimes, especially when it comes to equipment, right? They're using all different kinds of pumps and different kinds of ventilators. They are dealing with patients with different medications that are running on these pumps. They are dealing with patients with extensive disease processes going on all at one time, right? So they have to sort of know how to deal with this equipment, how to deal with these types of patients. And to me, you know, this is the sort of element of EMS that kind of gets glossed over as just being the transport bus, when in reality there's a lot more going on with these patients. The documentation is a little trickier, okay? So that's something I've always thought should be its own sort of specialty, where it commands a little more money and things like that. I'm not a transport paramedic now, but you know, there's been times during my career where I was a transport paramedic, and I remember being faced with this equipment, you know, having 2-3 pumps running at one time, and I never had any formal training on it, right? It was sort of the OJT training on that stuff. So again, this is why I think, you know, that sort of job should be its own specialty in EMS. Get a little more salary, when it comes to that, and not really be looked down on as like the subculture of EMS, what you do until the 911 job opens up. And I think too many of us kind of look at it that way instead of stepping back and seeing what it really can be looked at. And believe it or not, yeah, being a transport paramedic, and when you go to 911, it certainly can help you be a much better 911 provider, because you recognize a lot of different diseases going on, before you become 911 paramedic, assessing different types of lung sounds on patients that already have something going on, right? So, just something to think about, right? If you're a transport paramedic, maybe you're waiting for that 911 job to come out, but just think about how much you can learn beforehand, okay? Before you get there, by taking advantage of that transport paramedic experience. All right, guys, that's going to be it for me. I don't want to keep going on about this. I think you kind of get the point. Think about what your specialty is. Let me know by leaving a comment in the notes below. Send me an email. It's contact@emsofficehours.com. Again, be sure to follow me on Instagram and on Twitter. It's @EMSSafe. And go to iTunes. Leave me some love there. All right, I'd really appreciate it, guys. All right, that's it for me. As always, questions, comments, send them to the email I mentioned. All right, contact@emsofficehours.com. And until next time, as always, I am Jim Hoffman for EMS Office Hours. Stay safe.